We're here with Dr. Jonathan Dunker talking about shoulder pain and torn labrum. When someone has shoulder pain, Dr. Dunker, how would they know if it's a torn labrum?
So a torn labrum typically occurs after a specific injury, and the labrum is a very unique structure in that it is a ring of cartilage that goes all around the socket side of the shoulder. So various areas of injury can actually present in different ways. Sometimes people can injure their labrum more on the front part where they will feel actual instability of their shoulder, whereas other injuries can be more towards the top of the labrum, and that can be simply pain with things like overhead activity, throwing, or reaching, such as reaching into the back seat of a car.
So to expand a little bit more, I guess, what role does the labrum play in our shoulders movements, and why would someone want to make sure that they get it fixed?
So the labrum is very important. It actually serves to provide some stability to the shoulder joint. The shoulder is composed of a ball that's attached to the arm bone, as well as a very shallow socket that's on the shoulder blade side. And the labrum helps provide some increased depth to the socket to give the shoulder joint stability. So if you have an injury to that structure, a lot of times it can actually lead to feelings of instability or shifting of the shoulder, which usually is what brings patients in to get the shoulder looked at.
So when a patient does come in to get their shoulder looked at, what can they expect in that first appointment?
So in the first appointment, we will usually shoot x-rays of the shoulder, and that's to look at all the bone structures and to confirm that there aren't any structural injuries to the bone. And then we will take the patient through physical exam of their shoulder, doing both range of motion as well as specific physical exam maneuvers, which better lets us evaluate what the injury is that brought the patient in for.
What is Prevea's philosophy when it comes to treating someone with shoulder pain and a torn labrum?
So a lot of times we can treat these injuries conservatively, and that would involve some simple physical therapy as well as occasionally some medication to calm down the inflammation in the shoulder. In other scenarios, the tear may be severe enough that it requires surgical intervention.
If surgery is the right treatment option, what are the most common options with surgery?
So this is an injury that if treated surgically is usually done arthroscopically. That means that we are going to do it through several little incisions around the shoulder, utilizing a camera to visualize the structures of the shoulder. This gives us the ability to evaluate the structures initially and then treat them in a minimally invasive manner.
And so what do Prevea Orthopedics experts like yourself do in the operating room to ensure the best possible outcome for your patient?
Well, before we even get to the operating room, we make sure that we've got a specialized plan that's individualized for each patient. And then once in the operating room, we are making sure we take the utmost care of the patient, as well as making sure that we're versed in the most up-to-date techniques and procedures to do the best job for the patient.
And what does the recovery process look like after surgery?
So unfortunately, it is a slightly lengthy recovery. Typically, patients will be in a sling for anywhere from 6 to 8 weeks after the surgery, and they're typically limited on how much they can use the operative arm for about 12 weeks. The whole process from surgery until recovery typically will take about 6 months.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.